it's Harry Greenspun, and I'm delighted to be joined today by David Brueggeman, my excellent colleague. So, David, tell us, before we jump into talking about price transparency, tell us just a little bit about yourself and how you got to Guidehouse.
Yeah, absolutely. I had a circuitous path that took me through some banking experience, but after that was able to join healthcare. Spent about a decade working with payers and providers on really understanding the economics of the entire healthcare system. So was able to join Guidehouse about 3 years ago and have really enjoyed my time here.
Fantastic. So, we're talking about price transparency, and, obviously I can, if I'm shopping for a car or a washing machine or almost, any type of service, it's pretty easy for me now these days to get, clear pricing and comparative pricing from different places. Why has healthcare been so slow to adopt price transparency?
Well, unfortunately, unlike purchasing a car or any other sort of good that's out there, the understanding of what healthcare expenses need to be at the beginning of the process is a little more complicated. An individual goes into one of these service locations and doesn't have any idea of the services that need to be provided. All they know is they have a specific pain that they want to be able to address. So the challenge here is that the systems and the payers do not have a good understanding of those services that need to move forward. And so a lot of these new shoppability capabilities that are being brought online in response to these new regulations are to assist those that are a little bit more shoppable in nature. So if we think about orthopedic services, if we think about any sort of heart services that are not emergent in nature, then they really want to facilitate the shoppability of those services and making sure that you can price those moving forward. Unfortunately, there has been some challenges in implementing these rules as well, and payers and providers are feeling the brunt of that now.
Yeah, so so clearly, if I need a knee replacement or I need a new heart valve or something like that, those sort of things are obviously more shoppable than, I've got this weird ache here, so I'm not sure what that's going to be. But I think people understand that. What's been interesting is just the wide variation in what people wind up paying for the same procedure. What's the basis behind that?
Well, I think part of it has been just past negotiations. So without the information being available to the entire system, it's very difficult for one provider in a market to understand what another provider in the market is getting paid for those services. I think one of the challenges that we experience is that with this information that's coming out, some of those variables that go into that pricing. So think about things like, what is your market position? How many facilities do you have available in that market? What is the quality behind those services that are being provided? Some of that information has come out, but we never really had a relationship back to what is the price that's actually getting paid for that service. We're also seeing site of service shifts. So certain services that historically have been provided only in hospital systems are now being provided in ASCs. They're being provided in imaging centers that are out there. So as that information, price transparency information comes out, it becomes a new knowledge set that we can then be cross-referenced against these other variables in how folks are paid to create a normalization capability. It's really that economic work in action. We get to see it live, which is really exciting. But it will result in some fairly significant changes in how our hospital systems are getting paid and how our providers and payers position themselves within the different markets.
Now, what's interesting is that we've had some early regulation in this area and requirements and penalties for price transparency, for failure to adhere to price transparency, but not that much movement. What started and what is actually and why did some organizations decide not to actually provide price transparency and instead take the penalties?
Yeah, absolutely. Well, this is a really competitive area. And if we are in a premium position in terms of our pricing within a market, it doesn't behoove us to get that information out to, the general public. So that's one of the challenges I think that hospital systems wrestled with when it came time to put the price transparency information from the provider side. Now, with the new regulation that's coming into effect, the transparency and coverage that's coming out actually on 7/1 here, very, very soon, payers are required to provide that information not just from hospital systems, but also from a much broader group. So that includes DME providers, the physicians, and although it has been delayed, eventually the pharmacies as well. So a pretty significant amount of information that's coming out, and there's not really any place to hide anymore.
Well, I think it's interesting that, certainly some of the providers I've run into, they've still opted to say, you know what, the penalty for us not providing this information is far less than the premium pricing that we can enjoy by not declaring our pricing. But they're then grappling with, the sort of the new consumer movement of like, how are they going to be a consumer friendly organization? And where is that shift happening?
So, really there's a dichotomy in between these emergent services and these shoppable services. So when we think about the shoppable services, there's a significant change afoot. There is certainly, we talk a lot about our digital front door strategies to make sure that individuals are able to interact with the hospital system in the most appropriate way. But when it comes to the emergent services, not only do we have these challenges from a payment, and certainly we've seen entire payer strategies around emergent versus non-emergent services, but the emergent services now come into a new focus with the No Surprises Act, which now if there's an out-of-network service that is being provided, then now they're subject to the No Surprises Act, which ultimately determines some of the payment elements that come into play there. So we see these strategies moving forward. This is one of those things that if we look at the past few decades, we had a time frame where there was really DRGs came out. Everyone got really excited about how that was going to interact with the system. We saw the APCs come out, and of course that was a major change in how payments were made. And this is just that newest large change that really is going to change how we pay for healthcare within this country.
So, David's talking about how we pay. So I want you to take your payer provider hat off for a second and put on your patient hat. What are the sort of things that patients are going to see and be able to do going forward?
Well, it's really exciting. So as we think about how some of the regulations that include from the No Surprises Act, the advanced EOB. So if you currently have insurance, there is a regulation that will be forthcoming that ultimately will provide you, if a service is coming up, will actually provide you an explanation of benefits in advance of that service being provided. So that will include what happens from a benefits perspective, what happens from, what is your current payment and what will the payer pay on your behalf, which of course is really important because that affects your premium moving forward. So we see those changes coming up as the advanced EOB comes online. The shoppability and the understanding of where those services performed is going to be, continue to expand. Now, we also see from a digital structure, the requirements around shoppable services that are associated with the price transparency regulation is that we're seeing an evolution in what can happen through those tools that are being used by consumers. So as that evolution continues, we're seeing more and more connections to those consumers, which means more and more ability to impact those consumers in terms of, how can we help with the disease management and prevent you from going into the hospital in the first place. So continuing to close that gap in between what patients experience and what the hospital systems are ultimately looking to influence those patients towards.
Yeah. So, last question, if you were a health system that's been sort of sitting on the sidelines, paying penalties and sort of waiting for this to either go away or something like that, what do you tell them? What's the sort of the smart next step for them?
Well, unfortunately, with the payer information coming out, that information is going to be public here at the beginning of July anyway. So at this point, there's very few strategic reasons to keep that information close to the chest. However, it is really important that your system come up with a strategy, a communication strategy that involves your quality capabilities, your total cost of care control capabilities. These are all part of a story that needs to be told about your organization. And if that story isn't prepared today, you need to get yourself in line to do so.
Fascinating time and a really interesting topic, and really, will be interesting to see how the new regulation and these increased penalties are actually going to impact the ability for people like you and me to go out and shop for new healthcare services. So thank you again for joining us.
Thank you so much.